Good afternoon. This is the Sioux Falls Board of Health meeting for March 24th. It's a special Board of Health meeting, and I'm Jill Franken. I'm the Public Health Director with the City of Sioux Falls. And we have a number of folks on our board who are calling in for this meeting, and so I am going to now turn it over to our board chair, Liz Wheeler. If Liz, you want to take the board meeting from here.
Absolutely. Thank you so much, Jill, for welcoming everybody who's in the room. Again, Liz Wheeler, Chair of the Board of Health for the City of Sioux Falls. I'm so sorry that I'm not able to be there in person, as I know many of the members of the Board of Health are. Our absence is certainly not an indication of our lack of engagement. We are just practicing good social distancing and taking good care of ourselves and our family. Before we get started, I know we have a number of people that are on the phone, and so I wanted to do a roll call. So I will just, for those on the line, if you could just state your name.
David Meyer, board member.
Teresa Miller, board member.
Okay, and then any board members that are present in person?
Joe indicated she's here, Liz.
Great, thank you. Thank you, Joe, and thanks, David, and thanks, Teresa. So with that, we'll call the meeting to order. Today we have some new business, and I'm going to turn it over to Jill Franken for a COVID-19 situation update. And then following that update, we will move to public input.
Very good. Well, thank you so much, Liz, and thanks to everyone who's here. We have a number of individuals who are going to participate in providing this update to the Board of Health. First, I would like to ask Sandy Friends, who will give a situation update, and then to follow her will be two representatives from our health system who will also be providing an update. So Sandy, you want to kick us off?
Certainly. Thank you. Sandy Friends, Public Health Manager, City of Sioux Falls. So nationally, case counts of COVID-19 continue to increase. As of yesterday, so March 23rd, the Centers for Disease Control and Prevention reported 44,183 cases of COVID-19 with 544 deaths. Cases have been identified in all 50 states, as well as the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. 479 of the cases have been contributed to travel. 569 cases have been transmitted through person-to-person spread, and the source of the remaining 43,135 cases is still under investigation. Looking more locally, with case counts in South Dakota, there have been 30 confirmed cases of COVID-19 in the state. 5 of those cases have been confirmed in Minnehaha County. That accounts for about 16.7% of the cases. 7 confirmed cases reside in the Sioux Falls MSA, so the 4-county region that makes up our metropolitan statistical area. That accounts for about 23.3% of the cases. Looking at age distribution, 36.7% of the confirmed cases have been identified in people that are under the age of 40. 50% of the confirmed cases have been in people under the age of 50. The breakdown by gender is 9 of the cases, or 63% of the cases, 19 of the cases, or 63%, are in males, with 11 cases, or 37%, being in females. Counties of residence with confirmed COVID cases include Beadle County, Bonhomme, Brown, Brookings, Charles Mix, Coddington, Davison, Hughes, Lyman, McCook, Minnehaha, and Pennington County. Confirmed community spread has been announced in Beadle County at a level of substantial, in Hughes County and Lyman County and McCook County at a level of minimum to moderate spread. In addition, as being reported on the South Dakota Department of Health website, which is covid.sd.gov, there has been 1 death affiliated with this outbreak in the state. 790 samples have been tested negative for the presence of the virus, and 268 results are still pending at the South Dakota State Public Health Lab. If we look at case counts in our surrounding states, Minnesota has reported 262 cases, Iowa 105, North Dakota, 32 cases, Montana, 37 cases, Wyoming, 26 cases, and Nebraska, 52 cases. With that, I would like to introduce Dr. Mike Elliott. He is the Chief Medical Officer at Avera McKinnon.
Good afternoon, everyone. I'd like to start by just letting everyone know Avera is a tremendously proud partner of the community. Honored to be working with the City of Sioux Falls and our colleagues at Sanford. We are focusing our efforts to be ready. We have built up and continue to build up our surge capacity. We are practicing maximum conservation of masks, gloves, gowns, because we know they're going to be in short supply at some point in time. We've developed in-house testing, which shortens our turnaround time and allows us to rule in or rule out patients in our hospital faster than we've ever been able to do before. We are also utilizing our e-care, our virtual care options to their fullest capacity to deliver care quickly to patients with minimum exposure of our staff. Avera wants to stress the ongoing, and I would say increasing need for social distancing. Please avoid crowds, stay 6 feet away from people. If you have mild symptoms, please, please, please stay home. Do not spread this to other people. If your symptoms are more severe and you need to seek health care, please call first. Let us know that you're coming so that we can be maximally prepared to care for you without spreading the virus further. As some of you have probably heard, Avera has started or will be starting at Avera McKinnon a no visitor policy. The intent of this is to do exactly what I said, increase social distancing, slow the spread of this illness. It is of the utmost importance that we flatten this curve. You know, it's a tremendous honor to be a healthcare provider, to be part of a healthcare organization, to provide top quality care to people in this organization. Along with our partners at Sanford and the City of Sioux Falls, I want to assure you we are dedicated to continuing that effort through this pandemic. At this point, I will turn it over to my colleague at Sanford, Dr. Mike Wilde.
Thanks, Dr. Elliott, and good afternoon, everyone. First off, the chairwoman, Liz Wheeler, thank you for your example of social distancing and your excellent leadership, and you've set a good example in this room. If you can't see, really a excellent example of how a room should look, and thank you for that. Thank you, Dr. Elliott, for your comments. I am not going to reiterate because I think you hit a great point. I too would also like to point out that Sanford and Avera certainly have unified in serving this area. We know our responsibility to this community, and we take that very seriously, and we are working tirelessly to honor that and to be good citizens within this community. We have been working on surge capacity since this was first recognized internationally as an illness with potential spread. I would like to applaud the community for the measures taken. We have not seen a surge at this point, and there's been a lot of sacrifices made, and it shows. And simply to reiterate the message, to please continue that, because we need your help as partners in this community against a common enemy. Lastly, as we have gained the ability to test more rapidly, both ourselves and Avera, we anticipate there will be some growth in cases simply through recognition of the cases. We are ready. We stand together as healthcare systems to take on this challenge. I would encourage people also, just to reiterate, because it's so important, the message to really work on your own personal hygiene. think of where this could be, plan within your family, within your community, steps you can do to continue to flatten this curve, and at some point with success, and hopefully sooner as opposed to later. So thank you.
All right, Madam Chair, before I have Regan take it over and give us an update on all the activities in the EOC, I just want, if it's all right with you, I'd like to introduce the new board members who will be coming on as of this Friday. Dr. Mike Peckus is in the audience, and he's going to be joining this board soon. And then Renee Fink, Renee will also be joining. So really appreciate the fact that they are also here. They've been participating in the last couple meetings just to understand what we're doing and the updates that we've been providing to the board. So as of Friday, they'll be official. So Regan, do you want to go ahead next and talk about all the work of our super dedicated EOC?
Yeah, Regan Smith, Emergency Manager, City of Sioux Falls. Just giving an update on what our Community Incident Command System has been up to over many months. COVID-19, the city did develop a planning team. We met regularly, started sharing information with our community beginning in late January. The City Emergency Operations Center was opened and operational since March 20th. Consistent with other responses, the City Multi-Agency Coordination Team is supporting this response from our Emergency Operations Center. We are conducting daily operations briefing with our community partners, issuing daily situation reports. 25 of those reports have been issued to date, developed a community incident action plan, setting daily objectives and priorities. Currently, those are limit and slow down the number and spread of the illness and death, preserve continuity of community essential functions, minimize social disruption, minimize economic impact, and coordinate messaging for the public to keep them informed. Our unified command of this team is with us today. Our City Public Health Director, Jill Franken, Chief Medical Officer from Avera Health, Mike Elliott, and Chief Medical Officer from Sanford Health, Mike Wilde, and they are being advised by a medical advisory group that's made up of City and State Department of Health, Public Health, and then epidemiologists from Sanford and Avera as needed. Under this incident command system, we do have a joint public information section that consists of City, Department of Health, State Department of Health, Sioux Falls Public Schools, Sanford Health, Avera Health, and then the Helpline Center 211. They are conducting news briefings, press releases, social media, infographics, educational posts, as well as answering direct inquiries from the public and media. We have activated the Helpline Center 211 to answer calls for information, and they are receiving hundreds of calls a day. They are also leading the effort of the Unmet Needs Committee in the community. The key messages at this point for the public, these will be a repeat of what you've heard, but they are: be a good neighbor, keep your kids at home, be diligent about social distancing. It is the one thing we know we can do to flatten that curve. Use reliable sources for information, and finally, call your provider if you're sick. Don't just go to the clinic unless you're instructed to do so. We also have a liaison group that is working under that unified command. That consists of the City of Sioux Falls, Minnehaha and Lincoln counties, the court system, the Sioux Falls Chamber of Commerce, the South Dakota Department of Health, again, Sanford and Avera, the National Guard, Sioux Falls Public Schools, Bishop Gorman Catholic, Sioux Falls Christian, Harrisburg, and Brandon schools also. Under operations, the folks that are actually doing the work out there in the field, that is organized into branches. The first branch is the Sioux Falls Healthcare Coalition. They're working on the surge capacity issues, inventory management, and specimen collection. We have a public safety group that has been meeting that consists of fire, police, EMS, and Metro Communications 911. They've developed and implemented mitigation and response protocols and additional personal protective equipment for our EMS responders so they can protect the health and welfare of the public as well as our first responders. A third branch is the City Continuity of Operations Group, and they are working with all city departments in implementing their continuity of operations plans to continue essential government services and protect employees and the public. Our final branch is our Vulnerable Populations Group. The Sioux Falls Public Health Department and the Minnehaha County Human Services are working along with our hospital case managers and to develop protocol to assist with sheltering needs and meeting the needs of our most vulnerable populations as they either quarantine or isolate as needed. They're also coordinating the relief efforts for residents throughout the Sioux Falls and the metro, and working with the Sioux Falls community organizations active in disaster, Sioux Falls Helps, and One Sioux Falls Relief Fund. Thank you.
Thanks, Regan. That was a great overview. And I have to say to our Board of Health how it's pretty incredible to see all the work that's being done in this time of public health crisis that we're facing as a country and as a state and locally. I'm just super proud to be part of all these efforts in any way that I can, and any way that we all can. So next up, to you, Board, I just want to talk a little bit about now the executive order that was issued yesterday by the governor. We are still, digesting that so that we can completely understand all the implications. But we, even as of this morning, we had a meeting with our folks that interface with the entities that were included. And just to give you a sense of I think this was posted to you all in advance of the meeting, or you should have a copy, or there should be copies available for folks who need them. It does say for purposes of certain sections of this guidance, an enclosed retail business that promotes gatherings means any enclosed facility operating as a bar, restaurant, brewery, cafe, casino, coffee shop, recreational or athletic facility, health club, or entertainment venue. Those were those entities that were listed in the executive order. Some of the points that are most specific for those entities include restricting public gatherings of 10 or more people unless it's necessary. And then there's an item here that calls for review of business practices of each enclosed retail business that promotes public gatherings in their community for compliance with this executive order and to protect the ability of those businesses to innovate. That was a conversation we had, or a meeting we had this morning, was to really understand those two sections for the business community that is noted in this executive order. There's still, discussions happening about what does this mean. I know that our team has been having discussions with the state folks in terms of the intent of that particular section, and more to come on that. I don't have anything definitive at this point, but we sure will be providing more information depending on where we end up going in our community at this time. That's probably the most important way. There are other sections that really talk about what every South Dakotan should do, as well as all employers that are separate and apart from the ones that I just listed. And it really, quite a bit of that really talks about how to try and be as innovative as possible. I don't mean to paraphrase for the governor's executive order, but it does really talk about a lot of the things that we've already been talking about. How can you socially distance and keep your businesses open? How can you, as a general citizen, abide by social distancing, and how that will help us as an entire state? So, we, as I mentioned, we're continuing to understand that executive order and how that impacts Sioux Falls and what that means for our community. I just also want you to know that we are looking at all the other communities across the state, and we're looking at states that border South Dakota, because our city is very close to Minnesota, it's very close to Iowa, we're not that far from Nebraska. And so some communities that have already taken some social distancing or past social distancing regulation in South Dakota include Howard, Clark, Brookings, Watertown, Yankton, Rapid City, Mobridge, Huron, they did a resolution, and then Huron also passed an ordinance. So those particular, the things that they are doing, kind of to summarize what a number of those communities have taken on is they've closed on-site service to guests in restaurants, food courts, coffee houses, bars, cigar bars, vaping lounges, for example. They've also taken steps to cease operation at fitness centers, swimming pools, movie theaters, arcades, bingo halls, bowling alleys, and the like, places where people can congregate that are public facilities, also various entertainment, recreational facilities in addition to what I already named. So just to give you as a board a sense of, some of the actions that have been taken in communities around our state. And then also, we do know that Iowa has taken some action because they have defined community spread in Iowa. Minnesota has taken action. They have defined community spread. Parts of Nebraska, Douglas County and Cass County in Nebraska have taken action. North Dakota as a state has taken action as well due to community spread, as well as Wyoming has taken action due to community spread. Just to give you a sense, and I think that might have been, state, yep, that was the state in Wyoming. So just to give you kind of an overview in that perspective, the next thing I'd like to do is talk to you a little bit about what we've been understanding around the authority of the Board of Health as we've been identifying what might be options that we would want to bring to you as we continue to see cases of COVID in our community. And as you know, you have twice now passed regulation that has gone on to the City Council to restrict social gatherings. You did that first where it was recommended for no more than 250 people in our city buildings, city venues, right? Our city-owned and operated venues where people gather socially. And then you also did that again for groups of 10 in our city owned and managed venues. And so, and forgive me if I'm not getting that exactly correct, but that's the intent of it. So you took those two actions, which then went to our city council, and our city council adopted those actions. And so those were actions that were that are in effect right now. The first one, and then the second one, superseding the first one. So what we then started looking at is if more action needs to be recommended, if we need to take further action, and it was, there was a press release that we put out on Sunday that talked about the possible need to do further mitigation strategies, and that we thought there might be a need to come to you as a Board of Health in the near future to talk about those additional strategies. When we started looking at that with our really great city attorney's office, who's been doing a lot of work for us in how to stay doing this correctly, what they have found, and I'm going to give everyone a little history here, that our Board of Health, we've been fortunate as a city that we have not had to have our Board of Health take a lot of regulation action for quite some time. And so that's just been, fortunate for us. I think that's a good thing. And so they have resolved certain things, but they haven't had to take regulatory action. And so this regulatory action that they may have to consider here in the future, our city attorney was just understanding, are there any state laws that apply here? And we did identify that you are also under the direction of its South Dakota codified law, and I'm going to specifically read it. It's 9-32-2, and it says that City Board of Health powers and duties. It says each first or second class municipality may appoint a Board of Health and prescribe its powers and duties subject to the supervision of the State Department of Health. So that particular statement in the South Dakota law does require that there is supervision of the State Department of Health to you as a board. And so that's just something we have to take into consideration as we're figuring out how do we move forward with efforts in our community through you as a board. And so I would ask Stacey if there's any comments that you would want to make to sort of inform the board regarding that.
No, I think you summarized that pretty well. I guess I can provide some additional detail via city ordinance as to the powers and duties of the Board of Health itself. Or did you want to cover that, or do you want me to?
No, go ahead.
Okay. So there's a city ordinance 92.053, and what that does is it specifies essentially, again, the powers and duties of the Board of Health. I'll just read that. It's not terribly long. It says, the Board of Health shall exercise general supervision over the health of the city with full power to take all steps and use all measures necessary to promote the general cleanliness and healthfulness of the city and the general health and well-being of the people and community served. The board shall adopt any regulations, rules, or measures deemed advisable in order to carry out these charges. So that's the scope of the Board of Health's authority, again, subject per state statute to the supervision of the Department of Health for the state. And then in practice, again, what's occurred twice thus far is that when you were impaneled and you pass those regulations, those were then transferred over to the city council for their consideration as far as that being converted into an ordinance. As we sit here today, this meeting is informational. The intent of this is to ensure that the Board of Health has as much information as it needs now and for any subsequent meetings in the event that they face those decisions, but there will not be any votes today regarding how to exercise those powers and duties.
Thanks, Stacey. So very important is talking about what are our next steps, or what do we believe we need to be doing next as a community, as within the EOC, as the city. And the first and foremost is what you've been hearing from us every day, what you heard from both Dr. Wilde and Dr. Elliott, and that is slowing the spread. That is absolutely mission one that we have to accomplish in our community right now. We want to ensure that every person that needs health care in our community has access to it, and access to what we have already enjoyed by our systems, our healthcare providers in our community, and that is really high quality care. And we need to make sure that we can slow this spread and decrease this and dampen that curve, flatten that curve of demand due to this virus, and make sure that our health systems can handle all of us that may need their care in the coming days, weeks, and possibly months. And so we're working yesterday and today we were working off of really identifying that how do we maximally, manage through that executive order with the governor. However, I'm going to tell you that this is so fluid that every hour now we are getting more and more information about what's going on in our community. And so I am very confident that we will probably need this board to meet again tomorrow sometime. Because as we continue to, we've heard from both of the health systems that they have a lot of testing samples in the hopper that are probably actively being tested out right now. And so because of those number of tests being reported out, we know that could easily lead us to cases in Sioux Falls or in Minnehaha or Lincoln County that will confirm that we have community spread. So I would really just ask that you be at the ready to consider additional mitigation efforts that we may need to take, such as possibly those that we identified that may be needed when we sent out that press release on Sunday, kind of letting the community know we need to possibly consider additional actions. So I just want you as a board to be, aware of that and ready for that, and that we will do our best to manage the time well, because you have been so great to meet so often. For the public's awareness, this is a board that typically meets quarterly. And they have now, this is their third meeting in a week and a half, I believe, soon to possibly be now tomorrow a fourth meeting. And they have just stepped up and done a tremendous job. So, Madam Chair, that's really the updates I have for you now. I'll turn it back over to you.
Thank you, Jill. And Stacy and all who provided updates. This is really great information to have, and I'll speak on behalf of our board members that it's really helpful to have this type of information. As you mentioned, it's changing so often, and you've done a great job of keeping us informed. So I know this is our time during the Board of Health meeting when we do take some public input, and just keeping in mind the amount of time that we have, I think we will limit 3 minutes per person. If there are individuals in the audience that would like to provide their input, I will ask that they come forward and state their name.
Sierra Broussard, Sioux Falls. So I know the direction that this is going into. We have people that are on the massage board here. We have massage therapists. How many killings did we have this year on the regular flu? Doctors, how many? We had more. Y'all act like this is World War III hitting us here. We have people that are massage therapists that do medical massaging. They cannot afford to close their doors down. They still don't have an understanding from the massage board or the state of the health department if they're essential or a non-essential business. It is very critical that we keep these massage places open, because some of these massage businesses have special licenses for medical massaging. I think this has been out of hand here. It looks like it's been controlled. We don't have an epidemic here. I mean, the flu has killed more people this year than the COVID has so far, okay? We have 800 and something massage people. So if we're going to follow the guidance of the executive order that the governor has put and CDC guidelines that everybody's following, if it's not broken in our community and we're following it, then we should leave it alone for now. We should not be closing down businesses and all of this. If it comes to that, I'm going to ask council to go against the health department and vote no on this. We have massage therapists in here. We have people that rely. They have patients that rely, that get in car accidents, that have cancer. They rely, these patients rely on them. You can't go to the ER and get this kind of service. People that have their breasts removed that need this kind of treatment. You cannot go to the ER for this. This is very disturbing here, and I hope you don't take me the wrong way, but I think this is blown out of proportion. I think that the businesses should stay open, because I know where you're headed, to close businesses down and everything else, and then before you know it, the massage therapy is going to be hit too. Businesses here. It's controlled. And everybody is following what they have to follow in the city here. Do y'all realize that y'all need to, and I'm talking about the health department here, we need to reach out to these massage people. We have 800, Jill, and something people that have tried to reach out to the health department. They need guidance. Not every business of massaging is essential businesses. We have non-essential, just like we have massage therapists that do massaging and they do medical massaging. So we need, the health department needs to address to the massage industry their protocols here. They're not getting a straight and forward answer here. And this is the only reason why I'm here today, is to speak on the massage therapist. So council is sitting in the room here, I think that's moving forward. We should leave it alone unless it's an epidemic here. But I'm telling you right now, if y'all would look at just research, how many people has died of the flu this year?
Thank you, Sierra.
Thank you. Thank you so much for your comments. We've hit the 3-minute mark, and I want to be mindful of anyone else that's wanting to provide any input. Thank you.
Good afternoon. Teresa Staley, member of the City Council. Two things that I wanted to throw out. And we are having an informational meeting at 4 o'clock today, but the first, there seems to be some confusion in our community about who makes the ultimate decision about moving forward with more mandates on closures. And so some people think that the ultimate decision is lying with this board. Other people think that everything you decide will come to the council to decide. And then there's a discussion as to where the mayor intervenes on this as well. So at some point, and maybe this is just for our city attorney to be thinking about clarifying that. So as a city council member, I can be thinking, and all of us can be thinking about, how we're going to take any recommendations that you make as we're listening to the community. And then the second thing I want you to consider, and I've been vocal about this and my colleagues have as well, is that in 6 days, on Monday the 30th, we are slated to start absentee voting. We're slated to encourage our citizens to come to the election center near the county building and physically show up and cast their ballot for the April 14th election. I would like this body to make a statement about that. And if we do move forward, I know our city clerk is doing everything he can. I mean, he's being forced to move forward, and he's trying to make it as safe as possible. So what I would like you to do is make a statement as to what you think should happen. Some of us have suggested moving this whole thing to the June 2nd primary, but I'm hearing that legislators are now saying it's in the hands of the Secretary of State. Secretary of State and the governor are saying it's the legislators' responsibility, and it's all coming down to the veto day next Monday, which may or may not happen because they're not going to be able to show up and appear. So two things, if you could make a statement as to what you think should happen with this election, and then another statement that is going to give direction to our citizens that we can ensure them that they can show up to these voting places and feel safe, because that's their right to vote, and we don't want to put anyone in danger. So those are my two requests. Thank you.
Madam Chair.
Thank you, Councilor Staley.
Madam Chair, this is Stacy Koistra, City Attorney, and I don't intend to respond to all the public input, but I do want to provide some clarity regarding Councilor Staley's statement regarding how this process works, because that information has been provided, but as a City Attorney, I take seriously the clarity that our residents should have regarding how this will work. All of that's been put out, but put out in different locations. The mayor's been consistent in his messaging regarding his limitations on power when it comes to the emergency declaration. And he can make recommendations to this board, but beyond that, his emergency powers have been limited to convening the emergency sessions of the City Council, as well as the immediate efficacy of any ordinances that are passed, as well as suspending notice requirements on contracts, which has not been really a part of this current issue. As to the Board of Health, and as has occurred before, this board would be impaneled today as informational, so any recommendations or any guidance or any decisions are not coming today. I mentioned that earlier. But in the event that they would consider here soon regulations that they would pass, and those would be presented to the council for consideration. And so there's a due process component to this as we work through the tensions that exist, and by tensions I mean the tensions on liberty and conducting business with those of the safety and health of our community. So that'll be going through that process, and so the public would have notice, and additional public input would be provided at that time in the event a subsequent Board of Health hearing occurs.
Good afternoon, Board. Mayor Paul Tenhaken. Wanted to address you as a board, first off, to
say thank you for serving on this board. You probably didn't realize when you signed up that you would have this level of authority in the city, and quite honestly, I didn't know you would either. So thanks for being very fluid and flexible with us during this time. I want to just underscore a few things that Jill and some have already said here, and that is at the next meeting that we convene with you, I think you're going to be asked to make some recommendations to our city council to be voting on. And so I just wanted to prepare you for that. And those recommendations are not, you're not living on an island. Those will be made by myself and our public health director to you as the recommendations we think you should act on. So I want you to know you have cover in this process. We're working together in this. However, the fluidity of the situation is kind of underscored by the fact that even in the last hour, I have received phone calls and information from very credible healthcare sources that there is likely some cases of confirmed community spread in our county. And so that, if that is confirmed, that takes our response level to the next level, the next tier, okay? And so with that next tier comes enhanced measures that we would like to see enacted in our city. And so I just want to tee you up for the fact that this meeting tomorrow, likely tomorrow, I don't know if we've confirmed that or not, but it will likely be tomorrow, there will be a recommendation likely coming from myself as the mayor and Jill as our public health director to take a more aggressive step with some of the steps we need to take to slow the spread, flatten the curve in the city based on the cases we're seeing. We've said all along, and this is very consistent with the governor's office, we want to make data-driven, informed decisions. There is so much emotion around this topic right now. And we're making decisions based on CNN, we're making decisions based on Twitter, we're making decisions based on my cousin who lives in Phoenix. We're trying to use data. And in the next couple days, based on the fact that our healthcare systems now have the ability to be processing their own tests in much larger volumes than we've been able to see from the state, we will have good data. We will know the steps that we need to take in this process. So just want to tee you up for that meeting tomorrow because I think you'll be asked to take some steps. And our city council, which is meeting at 4 o'clock, will also then have to be the final say in that process. So you don't have to worry about your houses getting egged for any decisions you make. The buck stops with me on the first recommendation, with the council for their either thumbs up or thumbs down on where we have to head. So thank you for your work as a board, and I look forward to seeing you at our next meeting very soon. Thank you.
Thank you, Mayor Tenhagen. Yes.
Madam Chair, because sometimes we have to find something that we can find humor in. It feels really strange to be up here where Mayor Paul Tenhagen usually would sit, and he is speaking before the dais, so I just have to remark on that. So I think, Madam Chair, that is all the public input, it looks like. Did you want to turn it over for any questions from the board? I'm just offering that to kind of help you facilitate since you're remote.
Thank you. Yes, no, I appreciate that very much. Yes. Any questions from the board members that are on the line or in the room?
None from me.
No, great information today from all of you.
Joe, anything from you?
Nothing from Joe, Liz.
Okay, hearing none. I know that we're nearing the end of our meeting here. It's scheduled to finish at 3 p.m., but I'm not sure if we needed to do an executive session. I may have to defer to you, Jill, if that is something we need to do now. I know it was listed under new business.
I don't believe we need executive session, Liz. Thank you.
Great. Okay, with that, I believe I can adjourn the meeting. Is there a motion from one of our board members to adjourn our meeting today?
This is Dave. So moved.
Okay, in a second?
This is Teresa, second.
Okay, our meeting is adjourned.